Today, we're talking about an adversary that's incredibly good at hiding in plain sight: pancreatic cancer. It's often called the silent killer for a reason, and we're about to pull back the curtain and uncover its secrets.
So what makes this cancer so tricky? Well, it's sneaky. It usually doesn't show its face until it's pretty far along, and its first signs are ridiculously easy to mistake for something else. That's why spotting these subtle clues is absolutely everything.
Think about it like this. Your body is constantly sending you little messages, quiet whispers that are easy to ignore. But if you learn how to listen, really listen, it could change everything. These aren't just random aches and pains. They could be your body's first cry for help.
Okay, let's get right into the heart of the problem. Unlike a lot of other cancers, there's no standard routine screening test for pancreatic cancer for most people. And this is huge. It means that your own awareness, your ability to notice when something's just not right, is literally the most powerful tool we have for catching it early.
And why is catching it early such a big deal? Well, according to the National Cancer Institute, an early diagnosis can boost the 5-year survival rate by a massive 20%. That's not just a number. That represents real people, real lives saved, all because someone was paying attention.
All right, let's get into our first set of clues. We're going to look at some physical signs that are super common, but we're going to re-examine them through a whole new lens. You'll see what I mean.
First up, jaundice. Now, when you hear that word, you probably picture someone with bright yellow skin, right? But in the early stages, it can be so subtle you'd barely even notice it. But it's not just about your skin. You might see a faint golden tint in the whites of your eyes. But honestly, the bigger clues are often in the bathroom. In fact, dark, almost tea-colored urine is often the very first sign people notice. Paired with pale, greasy-looking stools, that's a major signal. It all happens because a tumor can block the bile duct, causing a substance called bilirubin to build up in your system.
Now here's a symptom that's a real curveball. It's one almost nobody would ever connect to pancreatic cancer, and that's what makes it so dangerous. This intense, generalized itching that seems to come from nowhere.
And I'm not talking about a little dry skin or a mosquito bite. This is an all-over itch, usually with no rash, and nothing seems to help. Not moisturizers, not allergy pills. It's often really bad on the palms of your hands and the soles of your feet. And guess what? It's caused by that exact same bilirubin buildup from jaundice. See? It's all connected.
Okay. This next one is a big one, a huge red flag. We're talking about dropping a noticeable amount of weight when you're not trying to. No diet, no new workout routine, the pounds are just melting away.
So, how do you know if it's just normal fluctuation or something more? Here's the benchmark: losing 5 to 10% of your total body weight over 6 to 12 months without an obvious reason. This happens because the cancer is just eating up your body's energy, and on top of that, your pancreas might not be making enough enzymes for you to absorb nutrients from your food.
We all get indigestion sometimes, right? But what if it just never goes away? When it becomes this constant problem that antacids and changing your diet don't fix, that's when the alarm bells should start ringing.
These digestive issues pop up because the pancreas isn't doing its job of releasing enzymes to break down food, especially fats. And this leads to some really specific changes in your stools. They can become bulky, really foul-smelling, and greasy, just like we talked about with jaundice. It really is all connected.
Now, pain is a pretty common symptom for a lot of things, but with pancreatic cancer, the pain itself is, well, it's peculiar. It's not usually a sharp, sudden pain, at least not at first. It's something different. Okay, so here's the classic pattern to look for. It often starts as this dull, nagging ache deep in your upper belly. And a lot of the time, that pain seems to shoot straight through to your back, right between your shoulder blades. And here's the really unique part. It often gets worse when you lie down, but feels a little better if you lean forward. That's from the tumor literally pressing on nerves and other organs. Okay, now we're going to shift gears and dive into the really surprising stuff. These are the clues that seem to come out of left field, connecting issues you'd never think were related. These are the body's deeper warnings. This is one of the most shocking connections for a lot of people. You know your pancreas makes insulin to control your blood sugar?
Well, if a tumor starts growing there, it can wreck the cells that make insulin. This can lead to a brand new diagnosis of diabetes, or if you already have it, a sudden nosedive in your ability to control it.
And get this, the number here is just staggering. One study found that up to 80% of patients with pancreatic cancer actually develop diabetes right before they're diagnosed. A sudden, out-of-the-blue change in your blood sugar is a sign that needs immediate attention.
All right, here's a symptom that's so unusual, you'd probably never in a million years link it to your pancreas: developing a blood clot, especially what's called a deep vein thrombosis, or a DVT, in your leg.
It's wild, but for some people, a blood clot that appears for no reason at all can be the very first and sometimes the only sign of an underlying cancer. It happens because cancer can release substances that make your blood stickier and more likely to clot. If you get a clot and you haven't been on a long flight or had an injury, that is a serious red flag.
And that brings us to our last clue. This one is so profound and honestly so tragic because it's so easily brushed off as something else. We're talking about a sudden, severe, and completely unexplained shift in your mood.
The sudden onset of deep depression or crippling anxiety, especially in someone who's never had mental health issues before, can be an early sign. The theory is that the tumor itself might be releasing chemicals that directly mess with your brain chemistry. A drastic personality shift shouldn't just be dismissed. It could literally be a physical cry for help.
So, what's the big takeaway from all this? The point isn't to make you panic over every little ache or itch. The point is to empower you, to give you the knowledge you need. These clues, especially when you see a couple of them together, are your body trying to speak to you. The key is to become your own best health advocate. These are the whispers, the signals your body sends that demand to be heard. If you feel deep down that something just isn't right, please don't ignore it. You are the #1 guardian of your own health. And now that you know the signs, you're better equipped to protect it. So, the only question left is, are you listening?